if you look at breast cancer treatments, many women are going to have either a mastectomy, which is a total removal of the breast, or if the tumor is small and localized, they may just have a lumpectomy. They may also have removal of lymph nodes in their armpit. So depending on where the cancer is gone, many women will also have radiation in addition to surgery. So they, or they may not, or in order to make sure that the cancer tissue is gone, or they may have chemotherapy. They may have all of the above. So they may have surgery, radiation, and chemotherapy. So they're all different types of treatments that really depends on the type of cancer and how advanced it is, what's the staging, and all sorts of different, whether it's a hormone-dependent cancer, whether it's a genetic type of cancer. So all of that makes a big difference. 5-year survival rates for breast cancer are very, very good. So many women live if it is isolated into the breast, but still pretty good if it is spread to nearby organs or tissues. But unfortunately, you can see survival drops off quite dramatically if it is advanced. I'm sure many of you remember Elizabeth Edwards from several years ago. She had stage 4 breast cancer. And although women can live several years, it is very tough to, because stage 4 breast cancer cannot be, cured. It can really only be managed. But we've seen, great improvements in the length of survival in all women. Colorectal cancer. This is the 3rd most common cancer. It's a very scary cancer. Like many cancers, a lot of people don't realize they have it until it's late. The symptoms are kind of vague. People may not realize they have it. 100,000 colon cancers per year, 40,000 of rectal cancers. So you can see a lot of the risk factors are very similar. So the increasing age 50 plus. So it is recommended that people have a screening colonoscopy at age 50, age 45 for African Americans. So because of the health disparity. Or younger if you have a family history of colon cancer, an immediate family member. Obesity does play a role. The role of hyperinsulinemia, as we talked about with type 2 diabetes. Low physical activity. There are lots of data that indicate the role of physical activity in colon cancer. So diets high in red meats, and low in fruits and vegetables. And diets high in red meat are also going to be high in saturated fat. Heavy alcohol consumption. So, alcohol consumption is always going to carry some risk. Smoking, as it causes many cancers, but you don't really think of it related to colon cancer. And also family history is very large with colon cancer. Treatments. Surgeries are often successful. It's very rare that someone has to have a total colostomy. People will have chemotherapy if the cancer has spread into, say, abdominal lymph nodes. Survival is very good if it's caught early. So many people do well at 1 year. 5 year, a little less than 2/3. So if it's advanced cancer, it's not going to do very well. And I personally know 3 women who died of colon cancer in their 50s and 60s. So it's very scary, and several of them and all of them, it was not found until it was advanced. Let's move on to lung cancer. About 200,000 cases per year. It is number 1 in cancer deaths. So although more women get breast cancer, lung cancer is the leading cause of cancer deaths. And we covered some of this when we were talking about the pulmonary diseases. Remember, lung cancer is a restrictive disease, and that there are 2 types of lung cancer. There's the small cell lung cancer that they can tell by biopsy. That's the aggressive kind, and people just don't live as long. And then the non-small cell lung cancer, people can live much longer with that, and especially if it's caught early. And as we've talked about the risk factors, And that does include secondhand smoke, and you remember the other ones. Lung cancer, people will often have surgery to remove the cancer. They may have chemotherapy. They may have radiation to shrink any tumors. They may take prednisone as an anti-inflammatory. And then eventually, at late stages, people may end up going into hospice care. So at 1 year, 40% of people survive. So that is not very good. So you can see very poor survival rates. As we mentioned, it has a lot to do with detections. Most people don't realize they have lung cancer until it is too late. And then at 5 years, the survival rate is only 15%. So better with early detection and if it's a non-small cell lung cancer.